informal talk because I was ordered by Dr. Bhatti that I have to present yesterday. So it's going to be kind of a small informal talk. First of all, and I was told it has to be depression. So depression. Now, what is depression? I'm very sure almost everybody in this room has at some point in time have thought about, today I'm feeling very depressed, or aaj, dil bada udaas ho raha hai, ya it is like today it's not a good day. Is that depression? Well, we have to know it is not. It can be, but it doesn't have to be. So being udaas, saying aaj main bahut depressed hu, that only doesn't comprises depression. Depression has to be other sign and symptom. In simple layman terminology, being sad it's not depression. So what is depression? Anything becomes a disorder when it hinders your functionality. Now again, there's a fine line there. You may be doing things what you are supposed to do, but you are not interested in doing them. You are dragging yourself. You don't want to do it, but you have to go to your job, you have to take care of kids. You are doing all of the above, but you have no interest in doing it. You have lost all the interest. You don't enjoy the things that you used to enjoy. You have no energy. You are dragging yourself to complete your chores. You don't like to talk to anybody. You like to stay in your room, just do things that you have to do. Although you are functional, but you have lost all the interest. You have low energy level. You are getting very emotional on small things, like crying for no reason. Somebody says something, you either cry, or if you are not the crying sort, then you might get very irritable. Now, this is not the irritability that a wife might have towards their husbands. So that's out. That is normal. But excessive irritability with regards to any and everybody, and you yourself think that why am I so snappy? This was very small thing somebody said. Why did I get irritable? So this is what is depression. Change in your sleep pattern. Either you are sleeping too much or you are sleeping too little. You cannot fall asleep. Getting multiple times during the night. Getting up at 4 o'clock and you are just up. You can't sleep. Change in your appetite. Either you are eating too much or you are eating too little. So all these things collectively will be depression. So only one thing, or being depressed for a day, or being sad for a day, or feel like crying for a day, is not clinical depression. Clinical depression will be when it's like a week or 2 weeks, continuously, or more than that. Continuously you are having this feeling of not wanting to be involved, not taking interest in your daily routine. As I said, excessively irritable or crying for no reason. So that will comprise clinical depression. One thing I would like to lay emphasis on, like any other condition, depression, like hypertension, diabetes, high cholesterol, depression is a clinical condition. It might be a state of mind, but there is a chemical imbalance which is happening there in one's body. So my thing is, don't say that guy is Cheria or that guy is, it is, be a little bit more empathetic and try to understand what is happening with a person. I think we as a community have to lay stress on that it should not be a taboo anymore. It should be considered as high blood pressure, diabetes, or anything, because there is something in your body which is decreasing. And in case of depression, there's a chemical called serotonin which is going down. So we need to build it up. Whether we do it if it's like in the initial stages or not so severe, it can be done by simple things as exercise, because serotonin is increased by doing exercise. Or maybe you need something more than that. It can be individual therapy, it can be group therapy, it can be medication, it can be combination of few things. But the main thing is to recognize it and not consider it as a person going crazy.
Thank you.
I have a question.
Sure.
These days, lots of on the Sanaland things are going on. Shall we call it depression?
I don't know what's going on Sana's list. I'm totally out of politics, but
No,
I can.
No, that is true.
That's a psychosis. That's more than that.
That is one
more
of the
than that.
conditions.
We'll do the question answer session in the end. I don't know about order, Amber. I still think it was a request, but thank you very much for doing this. Yesterday, the constant theme in this hall was that we must encourage our youth to take part and take the leadership role. So the next session, I am going to request everybody, after this session, don't leave, because the youth will be coming on and they have things to talk about, they have things to say. My next speaker is Dr. Bhatti. Of course, as I said, she is a gastroenterologist. She practices here in Michigan, and we requested her to talk about breast cancer screening. And Dr. Bhatti, please.
I thought it's Dr. Mehman.
Mehman by birth, Bhatti by marriage. Assalamu alaikum everyone, I'm Faiza Bhatti. I'm just starting my career in gastroenterology, and as we were discussing earlier this morning that maybe talking about colon cancer would have been a better topic for me, because this is what my specialty, this is what I do.
Come closer.
Come closer, okay.
Or you can take it in your hand.
Would that be better?
Yeah.
But I think breast cancer, as we know, is more common in our population, and the dilemma is that the screening is so less talked about. The females in our society think that if they don't have a family history of breast cancer, then maybe they don't have any risk of getting that cancer, which is not true. Your risk is maybe less, but still you are at the risk of getting the cancer, and the screening should be practiced like it is practiced in the Western population. Being in Pakistan, being in India, or being in any other third world country doesn't mean that you should not or you cannot get a screening for this cancer. So I'm going to give an overview in a very simplified version of breast cancer for a general population. So we can go to the next slide, please. So first, what is a cancer? Cancer is a growth of abnormal cells. These cells, we don't know exact cause why cancers happen, sometimes genetic mutations, sometimes external factors, but those cancers can damage and can invade into the other part of the body, and they can cause a lot of damage in persons psychologically, physically, financially, and a lot of damage can happen from that. So a female breast is composed of these three things. Lobules are the milk-producing glands, and the ducts are the tiny tubes that carry the milk from the glands towards the nipple. And the stroma is the fatty tissue, connective tissue, which surrounds the glands and the ducts. Next slide, please. So how common is breast cancer? Unfortunately, it's the #1 common cancer in the females. And it's the #1 cause of mortality caused by any cancers. It is more common in the Western population, but it is still #1 cancer happening in the female populations back home. Male breast cancers still happen. Doesn't mean that if you're a male, you don't have a breast. You still have the breast tissue, but it's a different form of breast. But it's still cancers happen in the male breast as well. It is very rare. 0.5 to 1% of all the cancers happening in the males are caused by the breast cancer in the USA and the UK. Africa has higher risk. It doesn't mean that because the breast is made differently. It's just considered because there is more prevalence of liver diseases there, and there is a phenomenon behind that when your liver is not working, there is a hormone, estrogen, which is produced in the female body, does not get metabolized, and there is a hyperestrogenism state in that patient who has liver disease. So unfortunately, we don't have a data published from the Pakistan, but we know that the hepatitis is an epidemic there. It's very common. Liver disease is like in the air. So the same thing happened there too. Males do get breast cancer. It's not diagnosed as early, so they die from it, but it still happens. And the risk factors are very similar as of females. Liver disease is one of the common. And I'm going to go down to the risk factors in the next slide, please. So what are the causes? Why does it happen? No one knows the exact cause. As I said, nobody knows why cancer happens, why it happens in one person and why it doesn't happen in the other person. Genetic mutations means that we all have this DNA. We all have a genetic makeup, and there sometimes mutations means alterations in the DNA happens, and those alterations, those mutations can lead to cancer formation. Some people have this unfortunate risk of getting those mutations from the family. And a very interesting factor is that there is a mutation BRCA1 and BRCA2 mutation, which is actually common back home. My own mother-in-law was actually diagnosed with that mutation when she passed away of ovarian cancer. And 5 of her other sisters have passed away either with breast cancer or ovarian cancers. But still, the screening is so badly practiced there. It is very sad to see that females in our population, they get shy of getting their breast examined. Self-breast examination is not practiced. All females should know that what their breast looks like, and they should examine it, and they should not get shy of getting it examined. All husbands, all brothers, all fathers should enforce their sisters, wives, and daughters to get themselves screened. Because if you go for a screening, your breast cancer may get diagnosed at an early stage. It may get captured, and you may get cured, because breast cancer is very curable now. But because our ladies don't go for screening, they get diagnosed at such a late stage that they end up dying from it. And younger the age, more aggressive is the breast cancer. So please don't ignore it. Get yourself screened. Next slide, please. What are the risk factors? Of course, gender, which you cannot change. Well, I'll take that back. Now we can get that gender change. Talk about Caitlyn Jenner. Their breast can get changed, but female are definitely more and more exposed to the risk of getting a breast cancer. Age, which you cannot change. I wish we could, right? We all want to stay young forever. But more you grow old, more are the risk of developing a breast cancer. And family history, so it's not very common, as I said earlier, that if you think that if you don't have a family history of breast cancer, then you are not at the risk of having this cancer. So only 5 to 10% of the breast cancer are actually familial. Rest of them are not. So rest of the 90% of the breast cancers are a spontaneous genetic mutation. Anybody sitting in this room, may God forbid, can have that mutation. And personal history, if a person has had breast cancer in one breast or in one part of the breast, that person is at higher risk of developing a breast cancer by nature. So if you have a breast cancer, your screening strategy will be different. And previous chest radiation. If people have had some sort of cancer in their chest, in their throat, and they have got radiation exposure in the chest area, that increases the risk of breast cancer as well. Next slide, please. Other talking still about the breast cancer risk factor, which is one more thing, that post-menopausal hormonal therapy. Menopause is not a pleasant phase. Whoever has gone through it, they know it. It's very miserable. Females go through a miserable period of time, and again, lack of knowledge, lack of education, they get stigmatized that, oh my God, depression is what Kazi talked about. So people go for hormonal therapy to get rid of those symptoms, and those hormonal therapy, which is not recommended that commonly now, increases the risk of breast cancer. Oral contraceptive pills, birth control pills also increases the risk of breast cancer. And the race is also gender. White women, as I said, westernized population, because of the diet exposure, because of more genetic mutations there, are more exposed to black women. And the mortality is higher in black women than white women because of the racial disparity, lack of exposure to the health insurance and all those things. And early menarche. If a female has had periods early at the age, like if they hit the periods for the first time, they hit the puberty at the age of 9, 8, which is becoming more and more common now. Females are getting puberty at the earlier age, means their body will be exposed to the estrogen for a longer period of time as compared to at the age of 13 or 15. So they have higher risk of developing breast cancer. And late menopause, as I said, menopause is not a pleasant thing, and we all feel that the female who is hitting menopause late in their life is actually lucky. Not so. They can have increased risk of developing breast cancer if they are hitting menopause late. Or not having kids. So when we are pregnant, as we all know, we don't get periods for the 9 months. So the estrogen exposure goes down. And that is actually a protective factor against breast cancer. And or having kids at a later age, that means you expose your body to estrogen for a longer period of time. So that's why having kids in early age and getting done with them is actually a good thing. So this, even Western society, is going back to what we practice back home. Shadi jaldi karaya, para jaldi kyo. It's not a conservative concept. It's actually healthier for you to get married in early age, to have kids in early age. Well, you can have kids without getting married too, right? So that's okay, but have kids at an early age. And breastfeeding is also protective, again, for the hormonal exposure. So do the breastfeeding, and as I said earlier, that Western population is actually going towards what we used to practice. So if you are a new mom, if your daughter, if your sister is a new mom, encourage them for breastfeeding. This is for your own benefit. You are giving a benefit to the baby, but you are protecting yourself too. So don't get shy away from it. It's a natural protection for yourself. Next slide, please. Again, talking about risk factor, the few common things that physical activity actually protects you. Just practice a healthy lifestyle, eat healthy, do the exercise. And our female population, even male, are very lazy. They don't want to do exercise. Even jogging, even walking, brisk walking is taken like a big thing to ask from them. So practice a healthy life, you will protect yourself from so many bad things. More activity, lower the risk. Overweight, obesity is also, you get so many diseases from obesity anyways, but your cancer risk also increases, especially breast cancer. And alcohol, thankfully, I hope our females don't drink alcohol as much, but alcohol can increase the risk of breast cancer. So, and other drugs like marijuana, anabolic steroids, the guys who uses the testosterone to build up their muscles. Some female sports activity can also cause that, but stay away from this. And I don't have to emphasize on those things because our females are fortunate to have a lot better lifestyle than what a typical American women do. Next slide, please. And how can we prevent it? You can just keep going. So there is no sure way to prevent cancer. If it is written in your genetic makeup, if it is in your DNA, you are going to get it. But there are a few things that you can do, as I said, that practice a healthy lifestyle. Just be good to yourself. Just be a little bit selfish. Put away the phones. Put away the kids' responsibility. Just take care of yourself. Because if you are healthy, then you can take care of your family. So just take care of yourself. Next slide, please. And then, as I have talked about all these things already. Next slide. And why screening for breast cancer? I have talked about these things too, so I'm going to skip that to keep it short. And breast cancer, how do we screen it? It's done with a mammogram, which is not a very pleasant test to go through. Whoever has gone through it knows that it's very painful and it takes time, but it's a mammogram, and the one is a breast MRI in special cases. Not everybody needs a breast MRI for a screening. Next. This is the mammogram, and you can see that there's a breast tissue showing, but the white spot in the top portion is actually the cancer. That's how the cancer shows up in the MRI, in the mammogram. And this is the breast MRI, and you can still see that one breast on the left side is normal, and the other side is abnormal and has an ugly-looking cancer in that. So this is how MRI looks. Next slide, please. Okay, so American Cancer Society recommendation: women starting from 45 needs to get a screening. From 40 to 44, it's up to you. If you are very vigilant, if you have insurance, if you are worried, you should get a screen, but actually age 45 and above, you should get a mammogram every year, and 55 and older should get every 2 years. Next slide, please. For women at higher risk with a family history, MRI mammogram should be done every year. Next slide. And again, I have talked about all these things again, that please take care of yourself, don't get shy, and all these nice gentlemen sitting out there, please take care of your females and get them screened. I hope this was a useful topic for you guys, and you guys are going home with some good message. Thank you.
Thank you, Dr. Bhatti. Obviously,